Okay, so I'm gonna make sure my stethoscope's on. Place this right over the top of her brachial artery. I'm gonna support her arm. So I want her totally relaxed while I take her blood pressure. Pull the arm up to heart level. I'm gonna pump up the blood pressure to about 160. And slowly release this valve and let it drop. So I'm gonna open it all the way to the left and let the air finish coming out of the cuff. And I'm remembering my blood pressure. Now, this is what some of you noticed when you were playing with the cuffs just a minute ago. You noticed that you could see the gauge is starting to bounce, and that's because it's picking up the pulse. Just because it's doing that doesn't mean you're hearing it. Don't let that trip you up. Sometimes it'll start to do that, but I don't hear a pulse yet. When you hear it, that's the number you need to remember. Keep it locked in your head. So I heard hers at 122. I'm remembering 122, and I'm watching this continue to fall. Boom, boom, boom. So when you quit hearing that pulse, that's the number you need to remember on your bottom number. Top number is going to be your systolic reading. Remember that word we had? Systolic meant contraction. So this is when your heart is contracting. That's the first number we're reading. So that's the pressure against the artery walls when your heart is squeezing. And then the diastolic is the bottom number. And that is when that heart is now a relaxed phase or has dilated open. So those are the two readings. That's what you're listening for when you're taking a blood pressure. It'll always be in a fraction. Top number, bottom number.